Hi there, it's Jennifer, and today we're going to talk about and demo how to apply a chemical peel on the upper lip area and why you would want to do that. The most commonly used acid to get dramatic changes on the lip area is TCA, or trichloroacetic acid. If you're looking to tighten up loose skin, lighten pigmentation caused from melasma or waxing, for example, increase firmness, and minimize smoker's lines, which may or may not have been caused by smoking, then a peel may be just what you need. Now, first things first, warnings and recommendations. If you're prone to fever blisters, you must pre-treat yourself with a prescription prior to performing any chemical peel. If you're dealing with sun damage, melasma, or have a naturally darker skin tone, pre-treat your area with Fade Bright or another melanin inhibitor for at least 2 weeks prior to performing a chemical peel. Last one, only do this peel 1 time per month. We're going to be using a higher percentage of TCA and possibly layers, so we need the appropriate downtime in between applications. And now the fun part. Let me walk you through the process and demonstrate the application. And remember, you don't have to do your entire lip area as I'm going to demonstrate. If you only have a small area here that you want to work on your lip lines, that's fine. Or if you just want to work at the spot down here, you apply it where you need to. So let me make sure I have everything I need first. I have my direction card for our lip peel. Now, TCA, we recommend using 20% solution when you're going to do the lip area. And I'm just going to open this up and I'm going to pour a little bit in the cup so you can see what I'm doing here. There's some in there, you can see me. I'll dip into that. And next, oops, now I have gauze pads, a couple of them right here, and I have a Q-tip. So I think I might do some with the gauze pad and some with Q-tip so we can see multiple ways to apply this. And then we need Vaseline or a barrier ointment. I'm going to be using our lip butter. We need Prep B, which I have some in a cup here, or 90% rubbing alcohol will work. And then also some nice cold water. I actually had an ice cube in there for rinsing. And with our lip peel kit, we also have some aftercare products, of which I'll explain when to put those on. Now, I have already washed my entire lip area around here. So the first step is to defat the skin. Now I'm going to take a gauze pad right here. Let's just saturate it in the B. Squeeze it out so we don't have any drips. And then I'm going to follow around the outside of my lip area, which is right here. I'm just going to go all the way around. And if you have oily skin or if you use an oil-based cleanser, you're going to want to do this an additional time. I'm going to go over one more time. Now, if you wish, since we're doing it in the mouth area, you can also target the nasal labial folds. I'm going to do that for you. That go from your nose to your mouth. And then there's also Marionette lines. They call those here, they go from your mouth straight down. I'm going to go ahead and prep that area too, and then we'll demonstrate. And those are really common areas where the lines appear first. So now we're ready to apply our peel there. Now I'm going to apply a barrier ointment on my entire area. You can use petroleum jelly and a Q-tip, or you can use our platinum lip butter. Anything that's going to block the acid from seeping is what you want. Now when you apply this, take care to make sure it's only going on the pink portion of your lips. Okay, now I'm going to put mine on. I wanted to get these corners really good. We don't want it. Ooh, that just tastes delicious. This is the blue raspberry. We don't want to get that on our lips because they're going to be flaking for days. They could crack. Oh, that would be very uncomfortable. Now, prepare your gauze pad or a Q-tip with the TCA. And then I'm going to use the Q-tip this time. And I'm just going to keep rolling it while I'm pushing on my cup to make sure we're not going to have any dripping. If you wanted to use a gauze pad, dip it in and then squeeze it a few times to make sure there's no dripping. Now we're going to apply the solution to the area just outside the pink lips because this is where the majority of lip lines are. So let me look in my mirror. Now, if you have deep lines here, make sure you don't have the peel solution pooling in the lines. Just dip in there a couple of times to make sure you don't have a bunch of solution in there, because how TCA works is while there's liquid sitting there, your skin is going to keep coagulating the proteins. So we don't want a puddle of liquid laying there where the acid will just keep going and going and going. We want to make sure it's just one smooth swipe, okay? And now, if you're going to target your nasal labial folds here to here, or your marionette lines, apply that too. So I'm going to apply that for you. Just going to go right down here, target that. This one, well, this is a fuzzy Q-tip. And then I'm going to go straight down where these marionette lines are. All right. Now we're going to wait 5 minutes. And then you can complete your peel, or you can apply the next layer to get a deeper peel. Now, depending on your individual skin, you may or may not see some frosting. Now, frosting is a white haze or a white speckles that shows you that the TCA is actively coagulating your skin's proteins. Now, it will naturally go away about 15 minutes or so. Nothing to worry about, it is perfectly normal. Now, if you see frosting after 5 minutes, you'll want to stop your peel here for your first time. If you do not see frosting and want a deeper peel, you can then apply another layer at that point. Now, we suggest that you do no more than 1 or maybe 2 layers when you apply this peel. Now, in the future, you may apply another layer if you wish, but use caution, as several layers of a strong acid such as TCA 20% can cause post-inflammatory hyperpigmentation. And what that means is that after the inflammation from the acid goes away, your skin could potentially become darker. So only do this if you're already using a melanin inhibitor such as our Fade Bright 2 times per day. Now I'm going to go ahead and apply 1 more layer, so I'm dipping this into my TCA. I actually really liked applying this with a Q-tip because I didn't get it all over my fingers. And basically I'm squeezing this out by pushing it on here and turning it so no drips are happening. And now I'm going to go ahead and apply a second layer. And then I'm going to do the nasal labial folds because we would love to stimulate some collagen production there. And then I'm going to go down into the marionette lines. And I'm just going to kind of feather it a little bit so I don't have big lines. Okay. Now I feel that happening. I've got some tingling, a little bit of burning going on right now. So I'm going to give this another 5 minutes and then we're going to see what happens. Okay, I am back and it's been 5 minutes and I actually do see a little bit of frosting here and a little bit of frosting here. And boy, I really feel it on my upper lip. So I think we're going to get some peeling here. Now, what we need to do, I'm going to rinse off I have my ice cold water in my washcloth here. And I'm going to go ahead and rinse this off. get a little bit more water. Now, when you're standing over a sink, well, you can just keep rinsing and rinsing and rinsing. That's what I like to do. Go ahead and rinse for a minute or so. You want to make sure to get all the solution off. And when we do that, it's going to calm any inflammation. And this nice ice cold water, just keep going until your skin feels normal, because it will. It just takes a few minutes. You just kind of keep getting more cold water, and I had an ice cube in here. This feels great. Okay, I'm feeling pretty darn good. Yep. All right, now, let me move this aside. Now, if you're dealing with pigmentation, now that we've rinsed off our acid, now is the perfect time to apply a few drops of your melanin inhibitor. If not, let's move forward. And if you have our lip peel kit, you can now apply a couple of drops of our Syn-TC 75% complex, and this is going to help to stimulate more collagen and more smoothing in the skin. So I'm going to apply this everywhere we peel. Down here. Almost forgot under my lip there. Alright. Now, let me just let that soak in for a second. And the next part of our kit is our Luminosity. And this is a high percentage of vitamin A. And we want to apply a tiny little, we don't need a lot. Just kind of dab it. Again, dab it everywhere we peeled. Almost like you're just finishing up at night after you wash your face. Now, we want to apply this Luminosity for the next 3 days. And basically that's going to be about the time your skin is ready to start flaking. You'll notice it feels dry and will probably start flaking. Then you can stop using that. Now you can continue using the Syn-TC every day. You use that every day forever. This is always going to help to stimulate collagen and elastin in your skin. Now, when we're all done, if you feel that you need some more hydration, emu oil is excellent. You can put a couple of drops, pat it on your face. If you do not have our lip peel kit, then go ahead, apply emu oil, apply our healing essential oil blend, or apply your favorite oils or creams. Now we're complete. So here is what you can expect next. Now, over the course of the next few days, your outer lip area will become dry. It's a peel. It could possibly become darker too. And all that is the dead skin getting ready to come off, so don't panic. Now you can run to our website and look at a few pictures on our TCA page to see what that dark skin looks like when you're applying multiple layers of a higher percentage. And I'll try to pop up a few here or here. Now, keep your skin hydrated. In about 3 days, your skin's going to get quite dry. For the next 3 to 5 days, you're most likely going to see some flaking. In about 7 days' time, that's average, you'll notice that all the dead skin is gone and your skin is going to be very smooth. Now, many times, you're going to notice those lines look better already, but generally, it will take a bit of time to get real long-lasting results. It takes time for collagen to grow deep in your skin. And TCA has been shown to continually stimulate collagen in the skin for up to 8 months after you apply it. So you're going to notice over the course of the next few months, your skin just getting better and better and better. Now continue using anti-aging products such as our retinol molecular serums and our Syn-TC 75% 2 times per day for best results. See how simple that was? Do you still have questions? We're always here to help. Just reach out to us. Have a great day.